We've been talking a lot about kids on the show this morning, but the truth is the older we get, the more important perhaps it becomes to take care of our health. One of those things includes osteoporosis, keeping your bones good and strong. Becky Geren is a physical therapist with CHI Memorial, here talking about Osteoporosis Awareness Month. Good to see you.
Thank you.
It's a problem. I mean, it's something I'm kind of keyed in on. I take a calcium tablet every day because, what is it, once you reach a certain age, you begin to lose that calcium, right?
Right. Actually, the statistics are pretty shocking that 55% of Americans over the age of 55 will actually develop osteoporosis, and then 1 in 2 women and 1 in 4 men will have a fracture over the age of 50.
It tends, but it is something not just through the supplements, like I mentioned, a calcium tablet,
right?
But exercise, weight training essentially strengthens those bones. Is that right?
Absolutely, yes. Physical therapy, exercise, weight bearing, strength training, balance, fall prevention, all of those things are key in treating osteoporosis.
Okay, I'm a little bit aware of some things because I've made no secret that I have an older mother and she fell recently. She does not have osteoporosis, but she's just almost 87 years old. So she's actually going to be fine. But one of the things that we learned, we think, is that her muscles in her legs, some are strong, some are weak, which points to your balance issue, right? Because as you age, you're just using muscles differently, and everything gets off. Correct.
And as our activity level decreases, then our muscle strength decreases with that.
So what are some things that people can do? Obviously, if they've had an injury, they're going to come to physical therapy, but what can they do to kind of go ahead and take some preventive measures?
There are a few easy exercises folks can start at home. One of them is my favorite. It is just standing up and sitting down from a good solid chair.
Okay.
If you can do it without your hands, that's great, but just working on standing up, sitting down.
That's easy.
Maybe it's easy, it's free, you can do it pretty much anywhere.
Would you do like?
I would start with about 10 repetitions and then maybe try to
3
work
times.
up to about 30 repetitions total of that once you get some endurance built up.
So what that strengthening is your quads and your hamstrings?
Quads, hamstrings, glutes, core.
Okay.
So all of those good large muscle groups to help us maintain our upright posture.
Okay.
So,
I like that one.
Yes.
Do you have any more tricks in
I
your hat?
do. So a couple of other, jumping jacks, as we all know from our childhood, are a great exercise. Maybe not ready to start jumping jacks again at age 50 or 55, but you can modify it. So one of the things you can do is just standing and just kind of step out.
Okay.
And just alternate, still raising your arms, shifting your weight. So that's going to work on some weight shifting with your balance. It's going to work on some weight bearing exercise through your legs.
Okay.
To
It
help
gets the
strengthen those
sides
bones.
of you working.
It does.
Okay.
It does, which are very important for maintaining our upright posture again.
Very good idea.
So, and then the last, you can do this with a chair if you feel like you would like to work on your balance before you perfect it, is maybe standing and elevating one leg and one arm, shifting your weight to the other side, elevating one leg and one arm. You can use a chair for support if you need to, just if you want to work on your balance and get it a little bit stronger so that you can do that alternating exercise.
I began doing some exercises, I don't know, 3 or 4 months ago, I guess, and lunges were part of them.
Yes.
And I would find that as I went to one side, when I would do this lunge, I would teeter like that.
Weaker on one side.
I was weaker on one side. And then it wasn't maybe a week or 2 of doing it that diminished.
Exactly.
So you will see results.
You will
fairly
see results.
quickly.
You will see results. Recommendations are 30 minutes of exercise a day, 2 to 3 days a week of some strength training or resistance exercise, but weight bearing exercises, balance exercises, 30 minutes a day every day. You will see results quickly.
Now, at your offices at Memorial,
yes.
Do you come to you only if you've had an injury, or can people come and just have strengthening training from
Absolutely.
you?
Folks can come in if you have a diagnosis of osteoporosis and would like to be educated on how to start an exercise program that is right for you. Then you can come in and see us. We can do a full assessment, look at posture, fall risk, your strength, and then develop a program that works for you and your lifestyle.
If you are diagnosed with osteoporosis, is that a reversible condition, or you just kind of keep it at bay?
It is not reversible, unfortunately, but you can maintain the bone strength that you have and you can prevent it from progressing. And the biggest thing that we want to work on is preventing fractures and preventing falls. So physical therapy is definitely key in that.
Not just because obviously nobody wants that, but if you have osteoporosis, does it make the recovery from that fall all the more difficult?
It can. Sometimes some of the surgical procedures cannot be performed either because of the bones loss and the weakness of the bone.
Okay, so when I get up and interview the next guest, I'm going to do this.
Yes.
Okay, very cool. That's an easy one to do. Becky Geren, you'll find her at CHI Memorial, 2 locations in Hickson, also the Hamilton Family YMCA. 495-7466 is the phone number. Thank you, Becky, so much.
Thank you, Julie.
And don't take this for granted. 55% of people over the age of 50 have osteoporosis.
Yes, ma'am.
Don't let that happen to you. We're back after this.